afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. I'm Vicki Hogarth at the CHCO News Desk. We will be hearing today from Premier Higgs and Dr. Russell. We haven't quite done the roll call yet for the journalists, so I'm not sure that there will be one done today, as some of the journalists are in the room. Many of us are still phoning in just due to COVID-19 regulations. We are expecting to hear about whether or not hospitals in the province have gone back quietly to their orange level of recovery just within the hospital system. I am sure Dr. Russell and Premier Higgs will address this at the start of the conference and provide us with those details and what exactly that means. So those are some of the things we are hearing as of this morning. For a quick recap of the numbers as we wait for the conference to get started, there are currently 632 active cases in the province. Now again, those numbers will change at the start of the conference when Dr. Russell gives us a list of the recoveries and as well the new cases for the day. In terms of the case breakdown, there are 172 active cases in Zone 1, 36 in Zone 2, 208 in Zone 3, 125 in Zone 4, 60 in Zone 5, 21 in Zone 6, and 10 in Zone 7. So obviously Zone 3 is the zone, the health zone in the province with the highest number of active cases. Now I am following online right now as well. I know there's a number of you watching there as well. I will be following the comments as we go along. We also have someone outside at CHCO, but off camera, monitoring the comments today so that if there is any problems with the odd person, just given the large number of people who do follow with us online, if there are any comments that aren't appropriate, I don't have to deal with that while I'm in the conference. Oh, we're just about to do a roll call, so hold on one second.
Just going to do a roll call for fellow Vicki Hogarth.
Here.
Erica Butler.
So that's roll call. I will just let the roll call continue, but it sounds like there will be a large number of journalists. You can hear this in the background right now as Bruce goes through the roll call.
Timothy Jake.
We'll have an idea then of how many questions we are able to ask. And once this roll call is done, I know it's a bit of a background noise for you right now as you're watching from home. I want to go over some of the common themes of questions that were sent in by viewers this week. There were a large number of questions sent in. So what I tried to do, and it's actually a lot easier for me to read, is I printed them into common themes instead of having a bunch of cue cards around me, just so I can hopefully address as much as I can today in terms of if I'm only able to ask one question, hopefully it's the one that has the most number of people asking it from home. Now, if you are watching in Campobello or have loved ones on Campobello, we found out this morning, MLA Kathy Baucus gave us a quick phone call here to let us know that the Campobello Island Ferry has been extended till the end of October. I know that doesn't answer everyone's questions in terms of how they will navigate winter this year on the island, but it is a start. It is something. I will provide you with more details as soon as I have them. I do believe it will be 4 days a week, and I know that it is at the expense, unfortunately, of islanders. It's not subsidized that I know of at this point in time. Let's just hear Bruce wrap up to see if he gives us an idea of.
Thank you.
No, he didn't let us know if we have one or two questions. It might be two today. So let me just go over some of the things that you are interested in. Now, something that we did hear this morning, so this isn't a question that was repeated a lot. It was just new news that we heard this morning, is that NACI, and that's the National Advisory Committee on Immunization in Canada, is now advising or I guess recommending that long-term care residents or seniors that live in communal settings with many people should be eligible for a third dose of a COVID-19, or otherwise known as a booster shot. So I have a feeling that is something that Dr. Russell will address at the start of the conference. I do believe Ontario, I don't want to get it wrong, Ontario or Quebec today already said that that was what they would be doing next after NACI made that recommendation. So there were other questions that came in about booster doses. Now one, I know I've asked this before, but I have it worded in a different way today if I do go down the route of asking these questions about mixed doses. So for instance, myself, I wanted to show you, I do have a smaller, my proof of vaccine I had made at Stationery Plus this morning into a much smaller version. It's $2, and between 9 and 2 p.m. if you do live in the Charlotte County area, they are making you can bring your proof of immunization there, and they can make it into a small wallet size card for $2, and it took all of 2 minutes to have done. So I feel it's much more convenient than bringing your paper around or trying to find a photo on your phone. So back to the question about immunization proof. So many of us, myself included, in New Brunswick were told to take the first dose available to you, which means my first dose was Pfizer, my second dose was Moderna. I know some people had the opposite, and many New Brunswickers are in that boat. So problematically, for people who are looking into future plans to travel, there are some countries that still, now I know that there is a lot of improvements being made and talks going on internationally where countries are changing their guidelines and accepting a mixed dose vaccination proof as and allowing people to travel into the country and recognizing that as being fully vaccinated. But there still are some countries that don't. So provinces like Quebec have decided that at the risk of the individual, you can get a third dose if you feel more comfortable, or if you're planning to travel and you want to have, say you have a Pfizer and Moderna, you want to get another Moderna, so you have 2 Modernas, or another Pfizer and have 2 Pfizers, so you have 3 shots, but 2 from one same manufacturer to therefore qualify as fully vaccinated in some countries that don't recognize the mixed dose. So I have asked this before. I don't know if it was fully addressed in the way that a lot of you are hoping to have an answer. So I have worded it differently today to see if there's, now that we are getting further into our booster shot guidelines in the province, maybe this is something that will be considered as we roll out the idea of a third shot. And again, there's another question that came in, is healthcare workers and teachers who would have had their first doses back in December 2020, January 2021. So getting closer and closer to a year since they were vaccinated. When will they be eligible for a third dose of it, or if they will be at all? We'd like to just have a little bit more information as to whether or not this is something we should consider doing in the near future, especially this year with the third wave and the Delta variant being more of an issue in the school setting. And not necessarily as much student-to-student transmission as we're seeing, but a lot has to do with students getting it outside of the home. And so when we're talking about teachers, that's adults. So if they would be eligible for a third dose anytime soon, a lot of you are curious to know. And that goes for healthcare workers as well. Now, again, I'm following online. I'm expecting that there will be some kind of news today, whether it's about third doses for seniors and long-term care residents, whether it has to do with orange level of recovery in hospitals or both. There definitely will be some information shared in today's conference that is, I don't want to say breaking news, but again, new information for us. So we might pivot in the conference and therefore take questions that I see from you posted online in the chat that's going on alongside the video. That's what I'm watching on my computer right now. If you wonder why I'm looking down occasionally, it's because I have my computer in front of me following the video right there. I also, if you're watching on television, that's my preferred way to watch if I'm not the one who's on TV. If I was at home, I'd be watching on TV too. You can always email me a question either during the conference, because my email is open as well, or for me to read after and to put in questions for future conferences. The best and easiest email to remember is news@chco.tv. That goes to everyone on the news team here. There are about 3 of us that receive that email. Big news team, I know. Or you can send them directly to me if you want to be more private about it at Vicki, VICKI.Hogarth, HOGARTH @CHCO.TV. Again, we should be starting momentarily. It's 2:38, but given that it's Premier Higgs and Dr. Russell today, we could be a few minutes delayed just waiting for this conference to get started. So I appreciate all of you who are sticking with us as we wait for Premier Higgs and Dr. Russell to be back in the conference room to give us the information at the start of the conference, and starting off with new case numbers and whatnot. So obviously when there is a conference, they keep the press release for the conference to release all the information. That on days when there aren't conferences, if you follow us on Facebook, you'll notice that it's usually around this time anyway that I will be posting numbers like the new case count for the day, the number of people who are vaccinated, if that's changed at all. Now, as of yesterday, 79.5% of eligible New Brunswickers were now fully vaccinated, and 88.4% have had at least 1 dose. Now, I know with the Delta variant, Dr. Russell had been mentioning that our new goal number, and Premier Higgs as well, our new goal is about a 90% vaccination rate for the eligible population, and that just has to do with how much more transmissible this virus is, and even for kids who can't yet be vaccinated. We need to have a higher vaccination rate in order to create some kind of herd immunity. And if you do follow us on Facebook, if you haven't seen our Newsbreak 26 report from last night, it's just about 5 minutes long. So I recommend checking it out. There were a lot of you that really enjoyed there were 2 conferences last Friday, and one, Dr. Dow was one of the lead infectious disease specialists for New Brunswick, who was participating in the first conference Friday last week. And you can find that full conference if you want on our Facebook page as well. But what he did was he shed a lot of light on the Delta variant and what that means in terms of New Brunswick's 4th wave. But what we did in our Newsbreak 26 last night was we tried to break down the key elements from that conference, just to give you some of the highlights about what it means. And Dr. Dow was saying that it's twice as transmissible. He also explained why this virus is, he used the word stickier than the original strain, which has a lot to do with why there are more children being infected with it. Now, he did say, we did actually ask him this directly on Friday, that we asked whether or not any of the hospitalizations were children under the age of 12, which is a significant number to look at because it is the age group that isn't eligible for a vaccine. So they're obviously a very vulnerable group of the population, because they're usually hanging out with obviously people from their class who are in the same age group. So the significant number of people that they are hanging out with and around on a daily basis aren't vaccinated. So we wondered if this was showing in the hospitalizations as well, because as we've been told, and if you follow internationally, the Delta variant seems to be affecting a lot younger people than the original strain did. And when you have a younger part of the population ineligible for a vaccine, well, that's extremely scary. So he did explain that, well, in New Brunswick, there isn't anyone at the moment hospitalized who is under the age of 12. However, he said to look at the international statistics, and it is a more troubling strain in terms of young people getting infected. So another question I did ask him is that Pfizer earlier this week, I think, or earlier last week, did say that they had done their studies and had sent them to, I believe, I don't want to get it wrong, but in the States, they've been sent to, I want to say the CDC, I'm probably wrong there. But anyways, Pfizer's own studies have been shown that it is as effective and actually effective and safe for kids in the 5 to 11-year-old age group. So those studies have now been sent to the health authorities of the United States. I believe Canada is looking at them now too. And Dr. Dow's hope is that potentially a month from now, maybe 2, hopefully before the end of 2021, we can have a vaccine approved for the age group of 5 to 11, which obviously with school being back in this year and this fall and winter and us staying inside more, it would be a critical component to us creating herd immunity to have that group of the population eligible for a vaccine. Now again, it's 2:42. I appreciate you staying with me, and especially all of you who are watching online and commenting. I'll check out all of your comments during the conference and later. A lot of you I can see just from the comments there are talking about the vaccine and its eligibility for younger people. Yes. Oh, there's Kathy Bacchus is just saying, thanks for the shout out for the Campobello Ferry. So yes, that's our MLA, Kathy Bacchus for the St. Croix riding, wrote me this morning and wanted me to let our viewers know that the ferry has been extended till the end of October to Campobello. I will post the details of what that means. I do believe it's similar to last year, where it's 4 days a week, and then it's also weather dependent. So you do want to check if it's a windy day. Chances are in the winter it won't run, but this time of year you probably will have luck with the Campobello ferry continuing on. Let me check out some of the other questions that we had sent in from viewers at home that I've compiled into a list of. Oh, here's another really important thing that came up a lot this week. A lot of you wrote in because you or someone in your household was waiting for test results. I do believe Dr. Russell will address this today, but there has been a backlog just in terms of the number of people who have been tested lately, not just in terms of, I think, getting your appointment to be tested, but also in terms of getting your results back. Now, we do know they still prioritize based on your exposure to COVID-19 or potential exposure where you go in terms of it's a triage of who goes first. But again, I was speaking with a mother this week who had to take her child out of school for about a week, just waiting for results that ended up being negative, but still a week of school was lost just in the wait time. And I did try to help her find numbers to call to see if there was a way that she could at least get an idea of when that she would receive the results. And in the process of trying to help her find that, the results finally did come in. But I know that the wait time is quite extensive, and I imagine Dr. Russell wants to encourage as many of us as possible to get tested when we have concerns that we may have been exposed. So I imagine she will address that too. If not, I'm sure it will be addressed in a question, if not by another journalist, then by me, depending on what is said at the start of the conference. Let's see what else. So yes, mixed dose was another big question. There was another, I did post this yesterday, I think it was. Horizon Health sent out a press release just yesterday about the idea of that some New Brunswickers, I suppose, are approaching members of public health asking to have falsified vaccination cards. Now, this is obviously a crime, and I do want to know a little bit more details. I'm sure that other journalists will ask as well, because this is something that if you've been following other countries where there have been proof of vaccination cards already in use for quite some time, this is something that's come up, and just wondering how that is rolling out in New Brunswick. To what extent is this an issue? I hope that it's only just a matter of a few people, but I'm sure Premier Higgs will be the one that will address that question, and maybe he won't even need it to be posed. He could address it at the start of the conference, just knowing that it's a crime. The fines obviously have gone up significantly. We've posted them in the odd press release that's come out. They've gone up to, I think, the maximum fine for breaking rules that are COVID related this fall has gone up to over $20,000, depending on what the offense is. So do be mindful for any of you who have decided to be lax with yourself. There are fines that are involved. I have actually seen what I thought was a compliance officer in town last weekend in St. Andrews, where I live and work. There was a festival, so I think they were just out checking to see that everything was being followed safely and properly. I don't think there were any problems in town, but they are out looking for non-compliance, and I don't think that necessarily if you're doing something that is, just accidental or unknowingly doing something that maybe breaks or stretches a rule, I think that they would tell you what it is you're doing wrong in hopes that you can just correct it and not repeat it. But I do know that if it seems to be something where someone is knowingly breaking rules, there are significant fines that are being put out now, so be very much careful and mindful. But I do know, obviously, if you're falsifying a vaccination record, you know exactly what you're doing, but you should know that the extent to which it is wrong and that it is considered a crime. So I don't know what exactly goes along with that, but there's a chance that Premier Higgs will be addressing that at the start of the conference. It's 2:47, so we should be starting any minute now. If you're just joining us, the journalists have all done a roll call, so we are waiting for the conference to get started. And for the time being, I'm just going over some of our questions that have come in from viewers. And again, as I mentioned to many of you, there was a significant number of questions that came in this week for obvious reasons, with us now moving into this proof of vaccination, with the return of the mandatory order and the Delta variant. All these new things we're learning about it. It's been a time for many of us to try to wrap our heads around our lives again, and always it seems that when we do have rules that return, there's always something that's a little different about it. And as Dr. Russell said, we will be changing. As this disease and this virus changes, we will change too. So you can't expect things to always be the same as they were before, and you have to understand too, as Dr. Dow mentioned, even the experts, because this is a new virus and it is an evolving, mutating virus, the experts themselves are learning about it as it changes. So the way we operate has to change with that as well. And sometimes that means, if you can remember way back to a time when masking was something that was still being questioned, this would be like over well over a year ago, and now it's actually been proven to be one of the most effective ways to stop spread. But again, there's always questions. I have them too. I find I'm always refreshing my understanding and having to read about what exactly the rules are again, just so I know, especially when I have questions or news reports to do, because I obviously don't want to get anything wrong there. Let's see what other questions have come in. So we talked about that. Also, another question many of you had is it time for a circuit breaker? Now, that's something, obviously, if you're looking at the numbers in Alberta.
Good afternoon,
oh,
everyone.
Here we are. We're about to go right into the conference room, so thank you for bearing with me. We will be heading to the conference room in about 15 seconds, and I'll see you after the conference.
Good afternoon, everyone. Bon après-midi à tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Welcome to today's update on COVID-19 in New Brunswick. Les porte-paroles cet après-midi sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre du Nouveau-Brunswick, Blaine Higgs. Speaking this afternoon on behalf of the province, Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Bon après-midi à toutes et à tous. Good afternoon, everyone. L'une des très tristes réalités de la pandémie de COVID-19 est que des personnes meurent des effets du virus. La semaine passée, nous avons enregistré plusieurs décès. 2 décès ont été déclarés hier et il y en a un de plus aujourd'hui. Une personne âgée de 90 ans et résident de la zone 1, la région de Moncton, est décédée. Ce ne sont pas juste des chiffres. Ce sont des personnes avec une vie et une famille qui aimaient et qui étaient aimées. One of the very sad realities of this COVID-19 pandemic is that people die from the effects of the virus. Over the past week, we have recorded several deaths. 2 deaths were reported yesterday, and there has been 1 more reported today. A person aged 90 and over residing in Zone 1, which is the Moncton region, has passed away. These are not just numbers. They are people with lives and families who loved and were loved. They were our fellow New Brunswickers. Each of the 57 deaths we have seen has diminished our province. My heart goes out to the families of these New Brunswickers in their time of sorrow. Your loss is felt by everyone in the province. Through this pandemic, we have all learned the hard lesson that we must accept the reality that we are experiencing, and that things will rarely go as we expect and hardly ever as we would like. We are in a dance, and it is the COVID-19 virus that calls that tune. And that dance that I'm referring to is that pattern of the hammer and the dance, whereby there are strict public health measures in place, and then we try to ride the different waves when that happens. When the virus has been very active, public health has recommended measures to government and the public to slow its spread. And when the virus has been less active, we have advised that these restrictions be relaxed. And these decisions that we have made at every turn in this pandemic are based on science and evidence, the epidemiological course of the virus, the social determinants of health, the state of our healthcare system, and New Brunswickers' mental health. Again, taking into account that this is at a population health level. Lorsque le virus était très actif, Santé publique a recommandé des mesures au gouvernement pour en ralentir la propagation. Lorsque le virus était moins actif, nous avons recommandé que ces restrictions soient assouplies. Les décisions que nous avons prises à chaque tournant de la pandémie sont basées sur la science et les données probantes, le cours épidémiologique du virus, les déterminants sociaux de la santé, l'état de notre système de soins de santé et la santé mentale des gens du Nouveau-Brunswick. Et c'est clair que les mesures qui sont plus sévères ont un impact très négatif sur l'économie, sur la société et sur la santé mentale. Nous devons trouver le bon équilibre dans les mesures que nous prenons. We must strike an appropriate balance in the measures we use. We cannot lock everyone down everywhere until the last case of COVID-19 has been eradicated. We have seen the toll that these measures take on our mental health, on our society, on our economy, on our education system. We are now in a serious situation that calls for serious measures. That is why we have moved away from the green phase of relaxed restrictions and brought back the state of emergency and the more stringent measures that are necessary to limit the impact of the COVID-19 virus. These new restrictions are not forever, any more than those we have recommended in the past. When the pressure on our hospitals has been reduced, we will be able to once again be able to relax the most restrictive measures. This will be the way of things for the foreseeable future. En date d'aujourd'hui, 79,8% des Néo-Brunswickois sont pleinement vaccinés. C'est une réalisation importante, mais on ne peut pas arrêter ici. Il faut que chacun qui puisse le faire se fasse vacciner pour se protéger, protéger sa famille et sa communauté. As of today, 79.8% of New Brunswickers are fully vaccinated. This is a significant achievement, but we can't stop there. We need everyone who can do so to roll up their sleeve to protect themselves, their families, and their communities. Our hospitals are coping with the influx of COVID-19 patients, but our healthcare system is under strain. As of today, there are 40 New Brunswickers in hospital due to COVID-19, with 16 of those patients currently in ICU. We need to reduce these numbers significantly before restrictions can be relaxed. We continue to see elevated case counts across the province, primarily among New Brunswickers who have not been fully vaccinated. The full list of the 84 new cases of COVID-19 reported today will be in our press release and on the GNB website. The increase in cases has led to an increase in demand for testing. And there have been delays in processing tests due to this increase, and our regional health authorities are responding. They are expanding capacity at assessment centers in Fredericton, Moncton, and St. John, and hired additional staff to expedite processing. Testing is processed on a priority basis with emphasis given to slowing down the spread of the active outbreaks within the province. There will be delays in processing tests for travel or other non-urgent reasons, and I ask everyone to be patient as we work to limit the spread of this virus. And again, I know that people are fatigued, there's no question, but I do ask that we continue to be kind. The measures that we have taken and we will continue to take are focused on protecting our healthcare system. And the evidence shows that for most of us, 2 doses of COVID-19 vaccine provides good protection against the harmful effects of the virus and the need to be hospitalized. It is clear that some people will need a booster shot. La semaine dernière, nous avons autorisé une 3e dose de vaccin pour les personnes dans la province qui sont très immunovulnérables, y compris les patients ayant le cancer et les personnes souffrant de maladies d'immunosuppression. D'après les nouveaux conseils du Comité consultatif national de l'immunisation, nous offrirons maintenant une dose de rappel aux aînés vivant dans les établissements de soins de longue durée et les autres milieux de vie en commun qui ont déjà reçu les 2e premières doses d'un vaccin à ARNM. Cela commencera au début d'octobre. Last week, we authorized a 3rd course of vaccines for New Brunswickers whose immune systems are severely compromised, including cancer patients and those with immune-suppressing diseases. This will help strengthen their body's defenses against the virus. Based on new advice from the National Advisory Committee on Immunization, we will now offer a booster to seniors living in long-term care homes and other congregate settings who have already received their first 2 doses of an mRNA vaccine. This will begin in early October. Our plan is to administer the COVID-19 booster along with our annual flu vaccine campaign. New advice from the National Advisory Committee makes it possible for us to provide both vaccines at the same time. And I'm sure that every New Brunswicker wishes that the COVID-19 pandemic was over. I am definitely in that camp with you, but this is the reality that we are facing. So we can't wish away the pandemic, but we can work together to protect ourselves and our fellow New Brunswickers by following public health guidance and advice. We can protect our mental health by taking a break from our phones and tablets and get out and get some fresh air. I know my daughter was really excited to go apple picking, so we're hoping to try to fit that in. We can take positive actions that will limit the spread of the virus, washing our hands regularly, wearing a mask in public places, maintaining physical distance from others. Most of all, we need as many New Brunswickers as possible to become vaccinated against COVID-19. We can stand together and bring these outbreaks under control. And I know that we can do this because we have done it so many times before. So please stay strong and protect one another and support and encourage one another. Thank you very much.
Good afternoon. Bonjour. Marcia and I were once again saddened to learn today that another New Brunswicker has lost their life as a result of COVID-19. We would like to express our sincere condolences to the family and friends of everyone who has lost loved ones over the past few days as a result of this virus. Our thoughts and prayers are with all of those who have been impacted by these tragic losses. 1 week ago, new public health measures came into effect in New Brunswick, including the mandatory use of masks in indoor public spaces, a requirement to show proof of vaccination when accessing certain businesses, and a travel registration for everyone entering the province. The state of emergency was reinstated last Friday, and the mandatory order went into effect at midnight. Les mesures supplémentaires visent à limiter les contacts, à garantir le maintien d'une distance physique. Existe que certaines entreprises et certains événements aient une politique de vaccination ou des dépistages sur les lieux de travail. In the last 7 days, inspectors and peace officers with the Department of Justice and Public Safety and WorkSafe New Brunswick visited 2,691 locations across the province. The goal of these initial visits was to ensure businesses were complying with the new regulations and to educate business owners, managers, and staff. I am happy to report that in this first week, 94% of businesses were in full compliance. This is indeed very encouraging. I know it hasn't been easy for businesses, and it's not easy when new rules are introduced, but time and time again, throughout the pandemic, the vast majority have stepped up and done what is needed. I want to thank the business community for adapting so quickly to the new rules. This week, we will be focusing on the small minority of businesses that are not in compliance. If you own or manage a business that is not making an effort required to keep us all safe, there will be consequences. Those who fail to comply, even after being advised by officers or inspectors, will face fines starting at $480, plus surcharges. Of course, much higher fines may be issued for repeat and ongoing violations, up to $20,400 per offense per day. I hope that fines will not be necessary. Je veux croire que chacun essaie de faire ce qu'il faut pour protéger ses voisins et ses concitoyens de Nouveau-Brunswick. We know that a big part of why we are in this position is because of the eligible New Brunswickers who have still not gotten vaccinated. With increased COVID-19 hospitalizations, we are seeing high occupancy rates, approximately 94%, in hospitals across this province. In the Upper River Valley Hospital, as an example, the labor and birth unit is closed temporarily as staff have been relocated to deal with COVID-19 cases. There are a few ICU patients from Evanston being transferred to Fredericton. The necessary changes are being done throughout the network. However, the network is strained, as Dr. Russell said. Les personnes qui ont besoin de services de santé de la province sont toutes touchées par la situation. Cette situation a de graves conséquences sur les professionnels de la santé. Elles travaillent de plus longues heures et avec des charges de travail plus lourdes. Our frontline workers and first responders have been working since the beginning of the pandemic to help keep us safe. I want to take a moment to thank them and let them know how much we appreciate their efforts. I especially want to mention our nurses. The best thing we can do to help nurses is to increase the number of nurses working in New Brunswick hospitals. And that is our commitment. In recent years, most recent graduates were offered casual work upon graduation and later could apply for full-time positions. We are working with our partners at the regional health authorities to ensure that going forward, every graduate from a New Brunswick university is offered permanent full-time employment as soon as they graduate to help alleviate some of the stress on the system. We also need to work on increasing the number of newcomers who arrive in New Brunswick every day with international nursing credentials. And when they do arrive here, we must expedite their accreditation to ensure their skills are properly recognized. We know there's plenty of work to do, but we are committed to getting it done. Le nombre de cas reste élevé et le nombre de hospitalisations est inquiétant. Il faut garder à l'esprit que les nouvelles mesures sont entrées en vigueur que la semaine dernière. Il faudra du temps avant de voir leurs résultats. The cases we are seeing now are the result of actions that likely took place before these measures were in place. As Dr. Russell said, we are aware that many people have been experiencing long wait times to get tested and to get the results. Currently, more than 4,600 people are in isolation in New Brunswick, many of whom are waiting for a test. I sympathize with those people, and I want them to know that we are currently looking for ways to alleviate these wait times and fix this problem, and it is getting better. For now, we need to be patient. If we continue to follow the rules and listen to the advice of public health, case numbers will decline soon, and we will all be able to move beyond this fourth wave together. Thank you. Merci.
Thank you, Premier. Merci beaucoup, Monsieur le Premier ministre, Dr. Russell. Nous allons maintenant procéder aux questions, aux périodes de questions avec les membres des médias. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. We'll now proceed to question period with members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. Premier Higgs, Horizon Health said some members of the public have approached public health staff to falsify vaccination cards. Can you tell us any more details and also what type of repercussions a person would face if they were to falsify a proof of vaccine and use it to go into establishments?
Well, I would be very surprised if anyone would actually agree to doing that. And obviously, it would be grounds for discipline of some sort. I would say termination of employment would be within that realm. But I would be very confident that it's not only unfortunate that someone would ask, but it's I'm confident that they would be refused.
And I can just add to that. So under the Public Health Act, it actually is an offense to make a false statement, either orally or in writing. And so with respect to proof of vaccination against COVID-19, medical exemption or travel, so under the mandatory order, a peace officer would be able to issue a fine in the amount of $480 plus surcharge and fees. And in instances where an offense is brought to court, in circumstances, a judge may issue a fine to an amount not exceeding $20,400.
Thank you, Ms. Hogarth. Erica Butler, CHMA.
Hi there, thank you. There's epidemiologists out there saying that rapid tests can be a tool to help snuff out outbreaks quickly and to keep places like schools open when there are cases in the community. And I've been told by the Department of Health that one high school in Perth Andover has been using rapid tests in, I guess, a kind of pilot since last week. New Brunswick has received over 1 million of these tests, but we've only used 2.1% of those. So they appear to be cheap and plentiful, and I'm wondering what is the holdup in using these tests as an extra measure in schools, daycares, and nursing homes?
Yes, so we are looking into how we can expand that program and making sure that it's used effectively and appropriately with all of the other tools from public health in terms of measures and contact tracing and isolation at this point in time. In terms of, why is it taking so long? Again, we're doing our best right now, and as more information becomes available on rolling that out, we can provide that. But we certainly acknowledge the issue right now about testing backlog. And actually, my apologies, that actually there is no testing pilot program as of right now. The tests are issued throughout the province, and there are small businesses and large employer programs, but it is our intention to partner with education and early childhood development to look at that. But again, I don't have a timeline on when that would happen.
Doctor, thank you, Ms. Butler. Tim Roselle, Global TV.
Hi, good afternoon. My question, I guess, would be for Premier Higgs. Premier Higgs, you and I spoke yesterday after the meeting of the Atlantic Premiers, and you had mentioned that there were no intentions at that time to add any new restrictions or make any changes, at least until the recent changes that were made have a chance to kind of take effect, and until the effect of those changes becomes clear. What has changed now, and what are the changes going to be? What's happening right now?
Well, right now, we're not introducing new changes. We're only talking about what enforcement of the rules that are currently in place. As Dr. Arnold just mentioned, we are looking at a testing policy for schools and in the education system and using rapid testing, and that'll be brought forward by the Department of Education in the coming days or week. And the issues around the backlog of testing to understand certainly what can be done there, and prioritizing to see that people that are impacted directly and that has, let's say, other impacts, unintended impacts, would be dealt with on a priority basis. I think that what we are doing right now, understanding hospitalizations and how we, as I mentioned, about transfers that are made or some things that are changing in a hospital to mitigate the impact on critical hospital requirements for other patients other than COVID. So those are things that are happening to manage the system that we're in right today. But new measures at this stage are not being contemplated as part of today, but it doesn't mean that it won't come in the future.
Thank you. Shelley Steeves, Global TV. Okay, we'll move on to Timothy Jakes with the Tribune.
Yes, my question's for the Premier. One of the exemptions to the border registration rules applies to, and I'm quoting, those accessing medical care not available in New Brunswick, end of quote. But this doesn't seem to apply to those from Quebec accessing healthcare services or pharmacies in Restigouche or Madawaska counties who have traditionally sought these services in New Brunswick, and that includes hospital services. Can you clarify the status of these people from Quebec if they're not fully vaccinated in order to cross the border?
At this point, I'm not aware that Quebec would be treated any differently than other Atlantic provinces in relation to accessing medical services. There will be precautions taken if these services are critical, certainly if they're not vaccinated, but we have not restricted access for medical reasons for anyone in that sense. It's just additional precautions have to be taken. And I would say, as far as being access to pharmacies, that could be an issue to discuss. How would those health needs or prescriptions being filled, how would that happen? But to ensure that someone can get their prescription, I would think we could figure that out.
Thank you, Mr. Jakes. Adam Huris, Brunswick News.
Thanks, Bruce. Just to follow up on Premier Higgs's comment that enforcement officers visited 2,700 businesses were there any tickets issued to those businesses? And then you said this week you're going to focus on those that are not complying. How would you know who's not complying? Is this through tips, or I guess how would you determine that?
The public safety officers actually went through communities throughout the province and visited businesses randomly. And, you know, in some cases they may have had information, but primarily it was kind of a general inspection throughout the province of say just under 3,000 businesses. And no, there weren't any fines levied at this point. Then we reported over 90% compliance. But for those that weren't compliant, I would say that at this point it was given clear instructions as this is what it will take for you to be compliant, and you need to do so within a certain time frame. And those businesses will be followed up on this week. And if further non-compliance exists, then that's the point when tickets start to show up.
Thank you. Michel Corriveau, Radio-Canada.
Merci, Bruce. C'est une question pour le Premier ministre, M. Higgs, et peut-être que Mme Dr. Russell voudrait répondre aussi. La question, voici, c'est la Commission des droits de la personne du Nouveau-Brunswick dit recevoir beaucoup de plaintes de gens qui estiment que les mesures sur la vaccination violent leurs droits. J'aimerais savoir ce que vous en pensez.
Well, we have had a clear instruction and interpretation, which I think we can share directly, and that outlines clearly about the position that this is not a human rights issue. There's not a violation issue here. It's a public health, public safety issue, and I think we should forward that directive or that interpretation to you, Michelle, so you can read it directly.
Merci beaucoup. Bobby Jean McKinnon, CBC.
Yes, thank you. Can you hear me?
Yes.
Dr. Russell, can you please tell us what our current testing supply stocks are and what you expect those to be in the weeks and months ahead?
Well, I think for right now, we're focused on getting our turnaround times to be lower and making sure that we have that individuals have access to testing in a timely way. So a few of the things in terms of reducing that backlog is to prioritize, as we always have, is the capacity to test making sure that we have the capacity to test the close contacts of known cases. So asymptomatic double vaccinated individuals also account for a large number of the increased demand. So if you don't have symptoms, please self-monitor and only request a test if you are symptomatic. Individuals not identified as contacts of cases are accounting for the vast majority of the backlog. We don't currently have any issues or reports around supply issues, so that's not part of any of the outstanding things that are happening right now. So again, we are continuing to triage and do the contact tracing and getting people registered for the testing. And I know that the Georges Dumont Hospital and the Moncton Hospital, I think they're working really hard to make sure that that testing capacity is there and that it gets done. And I think we're hitting really record numbers of testing and processing. And again, at this time, trying to reduce that turnaround time from the time that somebody requests a test to they actually get the test, they actually get a result.
Thank you. Thank you, Ms. McKinnon. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, j'aurais une question pour le Premier ministre. Monsieur Higgs, vous avez laissé entendre récemment qu'il serait possible de voir sous peu l'apparition d'un passeport vaccinal entre les provinces de l'Atlantique. En attendant l'arrivée du passeport vaccinal national, j'aimerais savoir, étant donné que la province du Québec est notre voisine directe et qu'elle a déjà en place un système similaire de code QR, est-ce qu'on a envisagé peut-être au Nouveau-Brunswick d'utiliser ou de se joindre à ce système-là afin peut-être d'harmoniser et d'avoir un système pour tout l'Est du Canada et non pas seulement avec les provinces atlantiques?
Yes, you are exactly right. But to clarify the position, we are each working on different timelines in the Atlantic region on having a vaccine registration. And we said that we were working towards, an automated system, a QR code, but also it wasn't so much as harmonizing between the four Atlantic provinces, because your point of Quebec already has one. Would we look at theirs and harmonizing in a more widespread fashion? But yes, but even further than that, the federal government has indicated during the election and since, and I have meetings with federal government officials in the coming days, basically to look at the full national code that would allow us to harmonize across the entire country. So it would be recognizable at every province. So that is the ultimate goal. And for now, what I would hope, because my initial understanding was it was going to take many months for the federal system to be in place, and we will learn that in the coming weeks, how long it's going to take. But my goal would be to harmonize with the national plan. And I know that's my colleague's goal as well in the other provinces, and the Atlantic provinces particularly. But ultimately, you're absolutely correct. That is our goal. We need to harmonize our system across the country.
Merci, Monsieur Boisvert. Thank you. Savannah Odd, Telegraph Journal.
Hi there, can you hear me?
Yes, Savannah.
Great. My question is for Dr. Russell. On Friday, we had Mr. Chalifou talk about the projections for hospitalizations kind of over the weeks leading up to when we would see these new public health measures take effect in terms of the case numbers. He said that public health was projecting between 35 and 40 hospitalizations at any one time over the next 2 weeks. I'm wondering what the projection is for the case count, whether that be, I guess, the active cases at any one time, as well as how many deaths we can expect to see over that time.
So basically, the information that is presented at Cabinet includes some of the scenarios that you just mentioned. And at the technical briefing on Friday, we did share that in 2 weeks' time, we did expect the hospitalization rate to go to 35 to 40 beds to be occupied with COVID-19 patients as per the medium risk scenario that we were projecting. So other than that, we will continue to have discussions about where we're going and where the trends are happening. It does take several weeks to see the impacts of public health measures that are put into place, give or take. So it's not clear at this time, again, how quickly things will start to trend downward, but we're hopeful and optimistic that that will be the case. But as of right now, we don't have any other projections that we're working with, just the ones that we just presented on Friday. And again, we're just keeping track of the case numbers as they come in, and the hospitalization rates. Again, we're working with the RHAs around the capacity and what's happening to juggle the services that need to be adjusted based on that right now.
But if you have a medium risk projection for hospitalizations, I'm sorry, you don't have a medium risk projection for cases?
That was it. The one we presented on Friday was the medium risk projection. We did not have a projection for deaths, but, prior to the variants of concern being at play, in particular the Delta, and prior to vaccination rates, we used to see a breakdown of cases, unvaccinated people prior to variants of concern being involved. Around 80% of people would not have very severe symptoms, 20% of people would have symptoms, 15% of those would require hospitalization, 5% of those would require ICU admission, and about half of those ICU admissions could result in death. Now, again, those are projections and stats that we used prior to variants of concern being involved and prior to our population being vaccinated at the level that it is right now.
Thank you. Alexander McDougall, Holton Pioneer Times.
Hello, yes. Not sure who my question should be directed to, but I'm just curious. I know that with regards to international travel, it's up to federal jurisdictions, but I remember sort of not last summer, but the summer previously, there had been some additional restrictions for international travel to New Brunswick. So I'm curious, with the reintroduction of the state of emergency, could there be any sort of potential disruption to international travel just at the provincial level, or is that something that would have to go through federal matters?
International travel would be federal responsibility, and so we would be looking for the federal government to put rules and regulations around that. And I do believe that's happening. I mean, we've seen recently the changes that were made to the U.S. requirements, as an example, the vaccines that were accepted or not, and where the AstraZeneca has now been accepted as to go to the U.S. is kind of a new development over the last little while. So that would be federal. We would be looking, and we are, have our rules as far as travel that's domestic, and that would be our jurisdiction at this point. But we work closely with the federal government, and they update us on policy changes. So we would just stay together on making sure that we can keep our population safe.
Thank you, Premier. Thank you, Mr. McDougall. Dr. Russell has some follow-up information pertaining to Erica Butler's question and also Timothy Jake's question.
So for Erica Butler's question around rapid tests, I'm not sure where your information came from, but we have not only used 2.1% of our rapid tests. We have shipped out thousands of the rapid tests through our Chamber of Commerce, and I think it's upwards of 125,000. So just to clarify that. And then the next piece is around Tim Jake's question. So between Hamilton and Quebec, there is a Jean Coutu with a pharmacy on the Quebec side of the Hamilton border, and unvaccinated Quebec residents can access the pharmacy there.
Thank you. Angèle Moore, APTN. Robin Grant, Brunswick News.
Hi, this is a question for Premier Higgs. First Nations leaders call your government's decision not to recognize the first National Day for Truth and Reconciliation as a provincial holiday a missed opportunity to repair damaged relations. What's your response to that?
Well, I think that, we've seen various positions taken across the country with provinces and with municipalities. However, there is a symbolism attached to that request or that situation the federal government took during an election. However, I would like to have more concrete actions that people can actually see a relationship repaired in tangible ways. And that's why, looking at the Truth and Reconciliation report, we've initiated 27 of the 31 recommendations that are now underway and to be implemented. In some ways, some examples of that would be bringing our First Nations history into the school curriculum. We've agreed to create a monument to mark this dark past in our Canadian history and how we can manage, to inform and educate. We've established a systemic racism commissioner so that it's real, tangible work in relation to to repair a relationship that we must in order to move forward together as a society. So I'm disappointed if it's seen as a slight in any way, because having more people take a day off is not necessarily going to encourage or learn more about the challenges we're facing together in our country and how we can manage them together. So, but having tangible results in areas that are important, and to look at communities across our province and say, every child in every community in New Brunswick needs to have the same hope of what they can be in a nation such as Canada. And that's my goal. And yes, it requires tough discussion. It requires tough decisions on issues that we just need to sort out, because this has been going on a long time and we haven't had, you can look at different governments coming and going, but have we moved the bar? And I am committed to moving the bar in a positive direction.
Ms. Grant, thank you, Premier. Simon Delatte, l'Acadie Nouvelle.
Oui, une question concernant la troisième dose du vaccin contre la COVID. Est-ce que les personnes qui vont refuser cette troisième dose qui auraient toutefois en reçu 2 par le passé, est-ce qu'elles seront tout de même considérées comme pleinement vaccinées?
Alors, c'est une excellente question. J'ai jamais entendu de quelqu'un qui ne voulait pas leur 3e dose à ce moment-ci, mais oui, ça peut arriver. Je ne sais pas si ça va faire une différence dans l'effet d'être complètement vacciné au niveau de la preuve. À ce moment-ci, je dirais non, ça ne va pas avoir un impact sur la preuve de vaccination à ce moment-ci. Mais ça peut changer. Alors, au fur et à mesure qu'on aura plus d'informations et plus de discussions sur le sujet, on pourrait donner ces informations-là. Mais à ce moment-ci, la réponse est non.
Merci beaucoup, M. Delat. Emma McPhee, Brunswick News.
Yes, my question is for Dr. Russell. And are there any cases at the St. John Regional Hospital? And if so, could they be categorized as an outbreak?
So as of right now, my understanding is that there is no outbreak declared at the St. John Regional Hospital, but they are investigating, obviously. But I can tell you that at the Moncton City Hospital, that there is an outbreak declared on the geriatric unit.
Thank you. Aiden Cox, CBC.
Hi, this question is for Premier Higgs. What help does the province plan to offer companies or individuals whose staffing or livelihood has been harmed by the long wait for test results? And if there isn't at the moment, why not? And is anything planned for the future?
Well, I think just as we did at the height of the pandemic, we looked at each business and our goal has been to keep them in business. And we're doing the same thing now. And I know staffing levels, and even though whether it's as a result of waiting for testing or it's a result of just can't get people back to work, because we are dealing with that with the federal government in terms of how the CERB is going to transition out into subsidies that actually can help people get back into the workforce. Because I think that is the biggest improvement that we can do as a society to help businesses. It's not about the couple days of whether I'm waiting for a test or not. It's about can I get people to actually fulfill the positions? And all over this province, I am seeing that people, are on a program right now that was needed at one time, but now we need to transition out. And that is a major discussion we're having, not only amongst provincial leaders, but certainly with our federal counterparts, because we need to address that for every business.
Thank you.
That concludes today's COVID-19 update for New Brunswick with Premier Higgs and Dr. Russell. Now, obviously, there was talk in our chat bubble online about what was the news exactly shared today. Just for a quick recap, the main information that was shared that is a change, and it's actually a very positive change, is that a booster shot will be available as of October for seniors who are living either in long-term care homes or in group settings. So that will be starting in October, and that will be a 3rd dose of a COVID-19 vaccine. Now, early last week as well, it was announced that immunocompromised New Brunswickers are also eligible for a 3rd dose of a COVID-19 vaccine. So again, as we can see, the booster shot, the 3rd dose, is rolling out more slowly in Canada and with more caution than in other places. But again, there now are 3 groups eligible, so that is a big change and I guess a positive one. I'm Vicki Hogarth at the CHCO News Desk. Thank you so much for joining us today. I'll see you next time.